Welcome. My name is Sibeli. I'm a physiotherapist based in Byron Bay in Australia. And I'd like to share some tips and advice on how to manage hip pain and loss of function in the hips related to labral tear and hip impingement. So in this course, we're going to be looking at what is labral tear and hip impingement, a brief review of your anatomy, the reasons why we can develop labral tear and hip impingement, and we're going to be exploring postural tips and exercise to try and help you manage your hip symptoms. So what is hip impingement and labral tear? To understand this, we should probably review some of the anatomy first, looking at the bones and the muscles around the hips and the pelvis. So the socket part of the hip is located within the pelvis, and the ball part of the hip is called femoral head, and it angles sideways to form a bony bump called greater trochanter before it heads down to the thigh bone of femur towards the knee. This bony bump can be felt on yourself on the widest part of the hip, on this area. So the socket of the hip faces a little bit forward, which means when the ball sits in the socket, it has a lot of support from the bone at the back of the socket, but not as much bony restraint at the front of the socket. Between the socket and the ball, we have a ring of cartilage that covers the edge of the socket called labrum. It looks like a calamari ring, and it serves to make the socket a little bit deeper. So the hip joint would be something like this. So we have the pelvis and then the hip joint sitting here. So the ball and socket is located right here in line with the groin. And then on the outside, we have this greater trochanter. That's the part that we can palpate, that we can feel on the outside. So when people have labral tear, they usually have a sharp and catching pain in the groin where the ball and socket joint is, and it's usually associated with movements such as flexion and internal rotation, or moving the leg up and across from the body. The most common place to tear the labrum is at the front, where the socket has less support, and it happens more often if the ball slides forward and puts a lot of pressure on the labrum for some reason. And one of the most common reasons for it is posture. So a lot of people, when they tend to stand into that position, we call that sway back posture, that's when the head of the femur or the ball shifts too far forward. So that would be sitting, so the ball would be sitting at the front of the socket, putting a lot of pressure on the labrum, and that can create impingement and then eventually micro tears in the labrum. So ideally, when we weight bear, we should be putting force through either the roof of the socket or the back of the socket, which happens naturally when we're standing upright, when we're walking. We don't want to be putting a lot of pressure at the front of the socket where that ring of cartilage is.